Welcome to day 4 of our Tareen Dermatology Lunch and Learns. Today we are in our exciting Faribault office, which is in southern Minnesota, so we're coming to you live from Faribault right now. Our topic today is skin cancer, most importantly what to look for and how to prevent it. So we're going to have an interesting discussion. I'd like to introduce you to my colleague Mindy Parker. Mindy is our Tareen Dermatology physician assistant in Faribault, and she's awesome, and she will give us a plethora of information as well. So in terms of the overview of our talk today we're going to talk about skin cancer basics, kind of what to look for, who gets it. Then we'll specifically go into each type of skin cancer. So we'll start with melanoma, which as you know is the most deadly type of skin cancer and can affect anybody from young to old, light to dark. Then we'll move on to skin cancers that are called basal and squamous, and then potentially some other more rare skin cancers. And then lastly, we'll move on to prevention. So what you can do to prevent you and your family members from getting this very common disease. First, before we begin, we're going to announce our winners from yesterday. Okay, Nicole, you want to come announce our winners?
Yes.
This is my colleague Nicole. She's going to go.
We're still live.
We're still live.
We'll
we
start
lost
over,
you.
Okay. We have Scott Bill, Stacy Eggstead, Nadia Khan, Julie Miller, and Shazia Rahman.
Yay! Yay!
There we go.
You will all get your little gift from our Lunch and Learn in the mail, so we'll just confirm your addresses. So congratulations to you 5.
Awesome.
Let's start with skin cancer basics. I'm going to just read you a few kind of startling statistics about skin cancer, and then we'll move on to talk about these in depth. So do you know that 1 in 5 Americans will develop a skin cancer by the age of 70? So it is very likely that you will get a skin cancer. Also kind of scary, did you know that there are more skin cancers diagnosed than all other cancers combined? So you add up all the lung cancer, breast cancer, prostate cancer, it still doesn't add up to how many skin cancers we detect in America. Another scary statistic, once you get a skin cancer, you are 66% likely to get another skin cancer. So we really want to focus on prevention. Mindy, you want to take some risk factors for skin cancer?
Yeah, definitely. So anybody that has light skin, light hair, light eyes, so our redheads or blondes or blue eyes, if we've had a family history of skin cancer, that does increase your risk as well. Anybody who is immunocompromised, so if you've had different types of cancer, if you've had any organ transplants where it suppresses your immune system, you are at increased risk for developing skin cancer as well.
And then one other thing people don't realize, sometimes the medicines you're on can actually make you at risk for skin cancer. So there are some high blood pressure medicines that increase the risk for a type of skin cancer called squamous. There are other medicines that we sometimes use for psoriasis and eczema to actually reduce your immune system, or rheumatoid arthritis, and by reducing your immune system, then your body can't protect itself against skin cancer, so you are at higher risk for it. So if you're in any of those categories, we recommend what's called a yearly full body skin exam. And you want to describe what a full body is?
Yeah, so we're literally looking you over head to toe. We're combing through your scalp, we're looking behind your ears, we're looking kind of in your lips, mouth area, in between your toes, places that people say, why are you looking there? I've never had any sun exposure to those areas. But melanoma, like we've been saying, is the most deadly skin cancer, and that actually can grow anywhere. It can grow in places that we haven't had any sun exposure, and that's from the DNA damage in the cells.
Yeah, so let's go to melanoma. So we'll show you kind of what typical melanomas look like. Let's see, where are we? Yep, thank you. So these are kind of prototypical melanomas. Melanoma arises from the melanocytes. Melanocytes are the pigmented cells of our skin. Melanocytes serve a purpose. So melanocytes help protect us from all that sun DNA damage. But sometimes these melanocytes will become cancerous, just like, our breast tissue can become cancerous, and, our lung tissue can become cancerous. From chronic DNA damage as well as genetic factors, these melanocytes can start mutating and dividing. And the interesting thing is, melanocytes are actually considered not to be necessarily skin cells. They're actually neural crest cells. They derive embryonically from the brain and they come outward. So that's what makes melanomas so deadly, because the melanocytes want to go back to the brain. So a lot of times, unfortunately, when you get melanoma, it will quickly metastasize to the brain and its organ of origin. So melanoma can happen in all individuals and individuals of growing, itching, becoming painful, any significant change, you should let your doctor and your dermatologist know. This is a really sad story. Sorry for the somewhat low resolution photo, but this little pink spot on the arm was a melanoma, and a stage 4 melanoma that we found. The patient, I take care of the whole patient's family, and the patient unfortunately is in heaven now. So that is really sad that these melanomas can arise as even pink spots. So if something's growing and you don't have an explanation for it, this poor patient who is now in heaven thought that it was just a hard bug bite, but it just didn't go away after a few months. So these are things that can unfortunately kill you, and it of course always happens to the nicest, the best people. Mindy, what are some things that you want to share with the audience about melanoma and your experience?
Yeah, so I think early detection is the key. There's a really high rate of survival, like 99% if you catch it early enough, that in 5 years you'll be alive. So we can easily treat that in the office with surgery. And then doing your self-skin checks every month can be really helpful, because that's how you can identify moles that you've had your whole life, as well as any new or changing moles. And then coming in for your annual skin checks, sometimes more often than once a year, depending on your skin cancer history.
Every day, Mindy and I take off the most subtle things that even we are surprised that come back as melanoma. So it really requires collaboration between your dermatologist and you. Like, you should have an eye on things, and we will definitely be your advocates as well. So, this is another melanoma, a really not terribly subtle melanoma, but a melanoma that arose right here, actually on the left arm of this 20-something-year-old teacher. His mom actually noticed it. The patient himself wasn't terribly concerned about it, but it came back as a stage 1 melanoma, so really nice in the top surface of the skin. You can see it actually arose from a mole he'd had for a long time, but you can see the irregular colors and everything like that. So we took it off. He is 100% clear. He's, life is good now. So it's all because he and his mom noticed it. So really, things that can be treated. Mindy's going to go through some criteria that you as lay people can use to help look at your moles.
Right, so you may have heard of this mnemonic before. We call it the A, B, C, D, E's of melanoma. So A, you can see at the top, stands for asymmetry. If you take a mole and you can't cut it in half and have the two sides match up and be symmetric, that sometimes is reason for concern. B stands for border, so anything that has jagged edges to it, it's not smooth and round. C stands for color, so moles typically are going to be one shade of brown or tan. If you have 2 or more colors, that does raise a red flag, and melanomas can actually, like Dr. Tareen's picture, be any shade. They can be pink, they can lose pigment over time. We think of them as being dark and black, but they can also lose pigment. D stands for diameter, so our rough estimate here is a 6 millimeters. So that's about the size of a pencil tip eraser. Anything that's larger than that, or certainly growing, come in and we can check that out. And then E stands for evolving. So this is the mole that you maybe have had, and then all of a sudden it begins to change in one way or another. It begins to grow, maybe starts to itch or bleed or take on any new symptoms. That's definitely something to get checked out sooner than later.
Awesome. So we will definitely take some questions about melanoma at the end, and at the end we'll talk about all things we can do to help prevent it. Let's move on to the most common type of skin cancer, something that we see in the office 100 times a day. This is something called basal cell skin cancer. Basal cell skin cancer is the most common type of skin cancer, like I said. Even though it sounds deep, basal, it's actually one of the most superficial types of skin cancer. It arises from some of the cells related to the hair follicles. It's characterized by these pink, shiny, somewhat easily bleedable spots. They sometimes have little extra blood vessels around them. Often, I will tell you, every single day, our patients will tell us, "Oh, Dr. Tareen, that's just a little scratch. That's just a little non-healing spot. That's just, some place where I bumped my head." But what happens, trauma can bring out these basal cells. So if you have something that's not healing over, 2-3 months, it probably should be checked for basal cell or something called squamous cell. But these are very, very, very easily treatable. Basal cell has a almost 0% chance of metastasis. There are unfortunately people who die of basal cells. That's typically if it kind of erodes into one of your blood vessels or if it really gets into a vital structure. So people ask me all the time, Dr. Tareen, why am I treating this basal cell if it's not going to cause, significant harm? The problem is these basal cells will continue to gnaw in and grow. Basal cells are actually called rodent ulcers, like a rat, because they just keep gnawing in. So bad case scenarios, Mindy and I see where these basal cells have gone into actually like the nasal septum, they've grown into the ear, they've grown into the chest wall, and it can cause some significant pain and loss of function. So that's why we treat basal cells as dermatologists. Let's move on to squamous cell carcinoma. Mindy, you want to talk a little bit about squamous cell?
Yeah, definitely. So squamous cells also arise from the top layer of the skin. We think a lot of squamous cell cancer develops because of the cumulative sun exposure that you have over your life. So these can present in a kind of a variety of ways, but classically we can see a red scaly plaque. Sometimes they present as more of a warty-like growth. So if you ever have a wart that's not responding to treatment and continues to grow with time, then that raises a red flag for potential squamous cell cancer. There is a bit more higher risk in squamous cell cancers of metastases, especially if our immune systems are compromised. So people do die from squamous cell cancer, unfortunately, if it's not caught early and if their immune systems are not, able to handle it. Another picture here. This was a treatment and removal of a squamous cell cancer by Dr. Tareen. So you can see that big, thick, scaly wart-like growth along this gentleman's temple. And then this is the surgery in the middle. That's how much we took out. And then that's the closure. You can see the skin came together very nicely and he did great.
He's really happy. He can't believe that he has no scar because it was a really large area. So the skin can be really nicely removed. Let's talk a little bit. There are a few other rare type of skin cancers that we don't see as commonly. There's a type of skin cancer called Merkel cell. Merkel cell arises from a deeper component of Merkel cells are neuroendocrine cells deeper in the surface. Those are very, very, very rare and they're very bad. And they typically arise as kind of a rapidly growing, non-specific kind of pink bed bug or bug bite like. So if you get something that's pink and rapidly growing, you should definitely go to the dermatologist. There's another type of skin cancer called angiosarcoma that arises from the blood vessels in the skin. You get these red bruise-like patches. So if you or your loved ones are developing a lot of really scary bruise-like patches that aren't going away, that is cause for going to the dermatologist as well. Let's move on to treatments. People ask me all the time, does skin cancer need to be treated? How can it be treated? Mindy, you want to take the discussion on creams and things for skin cancer, if there are creams?
Definitely. So some of the non-melanoma skin cancers that we've talked about, including the basal cell squamous cell cancers, can be appropriately treated in the right patient with topical creams. So these are considered kind of a topical chemotherapy cream where we're activating the immune system to cause inflammation, and then your body comes and kind of cleans up that inflammation, and with it clears up the superficial skin cancer. So that can be a really great option for patients that are not good surgical candidates for whatever reason.
Next, probably one of the most common ways to treat skin cancer is with surgery. So we literally just remove the cancer. Usually most parts of the body are amenable to just stitching it right back together. Sometimes we let the skin heal from the inside out. A really common treatment that we do is something called Mohs surgery. Mohs surgery is done for skin cancers on the head, the neck, the fingers, the toes, the genitalia, kind of those areas where we need to preserve the tissue. So actually the tumor is removed, a little layer of the tumor is removed, whatever is visible and what the Mohs surgeon thinks is appropriate. And then we flash freeze that tissue and we cut it into lots of little pieces and we look at it under the microscope. We actually have our lab here. You guys want to go on a little tour and we can show you our lab. So it's this tiny little setup. Like even when I worked in New York City, we could do Mohs surgery like in the smallest areas. And it has the highest cure rate because you're looking at the tissue under the microscope. So these are my wonderful assistants.
Hi, is Tyler there?
This is the Mohs, the cryostat where we freeze and cut the tissue. We dye it into all these little colors to help pick up if there are any skin cancer cells left behind. And then I look at it under the microscope right here. So literally, right, my patient in the room right across the hall, and I look at the slide and I say, hey, Mr. Smith, you are all clear. Or hey, Mr. Smith, there's a little bit of skin cancer left at the 2 o'clock margin, so we're gonna just take a little bit there. And then we repair them in the office, and it has a really, really great cosmetic and medical outcome because we're doing it all in real time. There's none of this 2 weeks later calling you and be like, sorry, you still got skin cancer. So it's a really nice option for skin cancer. Let's go back and let's talk about one of our favorite new things, which is called superficial radiation therapy. Mindy, you want to talk about superficial radiation? Yeah, right there. So this is a tour of our hair plot.
It's lovely. Radiation therapy is something that we started treating almost a year ago here. And we're one of the only clinics in the state of Minnesota that offer this therapy, but it's a really nice alternative to, again, skin cancer surgery. The end result is the same. We have a very similar cure rate to the surgery, but in the end, we end up not leaving you with a surgical scar, which is really nice. So there's areas of the body, like you can see this gentleman here, that are really great to treat because there's not a lot of tissue to pull back together in the ear when we do surgery. Another area that we do a lot of SRT treatment is the nose, because again, the cosmetic outcome can be much nicer with the radiation therapy. So it's basically, we use an ultrasound guidance to be able to see how deep the tumor is. And then Jordan, our lovely SRT tech who's sitting next to me now, will tell you more about it, but she can basically track the progress of the skin cancer tumor and watch it over the course of 20 treatments that are divided into 5 to 6 weeks total, and make sure that the skin cancer is completely treated.
So I'm the radiation therapist here in Fairfield. SRT is superficial radiation therapy. We do 20 treatments 3 times a week. If we have one area that we're treating, I can have you in and out within 10 minutes. We only treat millimeters deep and only treat the area around what was biopsied to make sure we get all those cells that we don't want to be there. And yeah, it's completely painless. You don't feel anything, you don't see anything, and
Patients love it.
yes.
Jordan and the patients can become good friends
Yes.
with the 20 sessions
we
of
do.
treatment.
Yep.
This is another picture of a patient that we successfully treated here with SRT. So you can see she had a big basal cell cancer at the top of the scalp, and then after 20 treatments, just a little bit of pinkness, and that will continue to fade with time and literally no scar at all.
And this woman was very scared. Like, clearly, that's a large skin cancer. She was so scared. She came to Mindy and I, and she was like, you know, I've had this lump growing forever. I'm so scared of surgery. So she was like so happy to have this treated. She gives us hugs all the time. Now she's in today, actually. So these are really nice treatments for our patients that are afraid of surgery or, you know, don't want a scar or things like that. I want you guys to know that radiation therapy for skin cancers has been around for 50, 60 years. So radiation is not new for skin cancers. We know it works. The problem used to be that we used to have these huge linear accelerators, and patients used to have to go to the hospital, and the treatment cost would be so cost prohibitive. Now they have these superficial radiation machines that encompass the radiation in a small machine that you can use in the office. So we've been using radiation in the office in dermatology for about 10 years now. Luckily, Tareen Dermatology was the first one in Minnesota to start treating people with superficial radiation. So we really have taken the ball. I had to go before the state legislature and prove all the data and everything like that these are safe in-office treatments. So we've treated hundreds of patients in the past year with really great results. Awesome. Absolutely. So we'll talk a little bit more about that in the questions too. Let's move on to kind of what I really want to focus on today, everyone, which is prevention of skin cancer. If you can find that slide for me, Mindy, please. So people always think that sunscreen is the only thing that you can do to prevent skin cancer. Sunscreen is key, but there's really a ton of other things to do. So one little thing, this is a very busy slide, but I'll walk everybody through it. So I think sunscreen is kind of last on the list. A few common sense items that I like to tell my patients are sun protective clothing is actually more important than sunscreen. If you can get, either a thickly woven shirt or one of those shirts that has SPF integrated into it, that it gives you much more coverage. Mindy and I use those sun protective clothings for our children all the time. Number 2, try to avoid the midday sun. That's when the sun is at its apex and its zenith. There you get so much more UV radiation there. There are some great vitamins that you can incorporate into your diet if you've had a significant history of skin cancer, or you want to talk about skin cancer prevention. Have you heard of this vitamin called niacinamide, also known as nicotinamide? This vitamin is in the B as in boy vitamin family, and it actually has been shown significantly in Australian studies where they have a very high incidence of skin cancer to reduce new basal and squamous cell skin cancer formation. And this vitamin is very well tolerated. It costs about 3 cents a day. So if you'd like some more information on that, we can give you some listings of where to get that and what to buy. There's another vitamin that I recommend to my patients who are really prone for melanoma, other skin cancers. It's called HelioCare. It's a botanical extract and it helps block DNA damage. So it's not something necessarily you have to take all the time, but let's say you're going on like a tropical vacation, or you're going to be getting a lot of sun. So that's really something that we recommend as well. Sunscreen, again, we like mineral sunscreens. What are your other prevention strategies, Mindy? I know you hate tanning booths.
Yes, so definitely avoid the tanning beds at all costs. The World Health Organization has named tanning beds a carcinogen, so it's known to cause skin cancer. We're seeing increased rates of melanoma in young people in their 20s and 30s, and a lot of that can be linked back to tanning bed use. So even going one time, there's a statistic that if you've been tanning once before the age of 35, it increases your risk of melanoma by 75%. So please stay out of the tanning booth. There's great ways if you feel like you need a sun-kissed look on your skin. There's lots of great sunless tanners and various formulas that you can apply and can kind of get that bronzed look all year long if you'd like.
For sure. The tanning bed is one of the worst things that wasn't invented. I don't know if you saw the recent study in the Star Tribune that Minnesota has one of the highest rates of acceleration of melanoma. Obviously, some of that is related to our population. We have a very high Caucasian population, but also because tanning booths are so ubiquitous, and so many people use tanning booths before they go to prom or before they go to big events. So Mindy's ideas of like sunless tanning, those really are amazing. Great. How much time do we have, guys?
7 minutes, so we can do questions.
Fantastic. Awesome.
Perfect. Colleen was wondering, are there any new treatments for basal cell carcinoma?
Superficial radiation therapy. So Colleen, great question. So, if it's a superficial basal cell carcinoma, depending on how deep it is under the microscope, sometimes, like Mindy said, we can use creams. Most often it's kind of in that surgical realm. But if patients are not wanting surgery and it is an appropriate cancer, we do a lot of this superficial beam radiation. So that's FDA approved, covered by insurance. There are some new things on the horizon, Colleen. There are a lot of studies on using lasers, so not radiation, lasers, which are safe beams of light to treat basal cell. So these lasers skip the epidermis, the top layer of the skin, and cause bulk heating to the dermis. So those are, definitely on the horizon. Some people are using them. They sometimes don't have as high of a cure rate. We haven't gotten to the point in medical science where we have the definitive data on lasers having as high of a cure rate as Mohs surgery or radiation, but that is something that I predict in the next 5 to 10 years will become more ubiquitous.
And then Debbie was wondering, should everyone have annual checks for skin cancer?
That's a great question. What do you think, Mindy?
I think it depends a lot on your family history, number one, the amount of sun damage, number two, and the number of moles that you have. So if you've had a family history, someone, first degree relative has had melanoma, then yes, we definitely recommend coming in for a baseline check. We'll evaluate the moles you do have and kind of assess whether or not you should continue with yearly skin checks or not. And the frequency of how often to be coming in based on the factors of your light skin, freckling, and the amount of sun damage.
I agree. Some people need to come in every 5 years. Some people need to come in every 3 months. Afterwards, on top of some of my young assistants who are actually filming, and several of them have had some atypical precancerous moles, and they can tell you their experience just as young people.
Along with that, Holly was wondering, when should you start skin checks?
So we recommend starting skin checks on your children right away. I know Mindy and I will, just keep an eye on our own children's skin when when we have patients who have a significant family history or personal history of skin cancer. We will start seeing their children young and kind of just monitoring their moles along. What do you say, Mindy?
Yeah, I agree with that. I think the sooner the better if you've had a family history. If you have, a kid that's covered in moles, and it's not a bad idea to bring them in, just get a baseline check. A lot of times they're all, congenital and benign, but we can at least take some pictures and some measurements and then monitor that down the road to ensure that there's no worrisome changes that occur.
They did a really great study. I thought this was a great study in Australia where they did 2 arms in the study. It was a family with family history of melanoma and significant skin cancer. One arm of the study, the parents did meticulous sun protection, sun protective clothing, sunscreen all the time. The other arm of the study, the kids just did kind of regular sunscreen like kind of we all do. They found 7 years later that the meticulous sunscreen arm kids had significantly less moles that developed over time compared to the other arm where the kids just got more and more moles over time. So the more moles you have, the higher risk you are of skin cancer. So if you can do meticulous sun protection, you are setting your kids up for less moles over time.
Jane was wondering, how do you know if you should have surgery versus radiation or vice versa?
You want to take that?
Yeah, exactly. So a lot of it boils down to if you're a good surgical candidate. Some people have mobility issues and other chronic health issues that don't make them as good of a surgical candidate. We take into account the location. Like we said before, the areas of the body that we don't have a lot of skin to work with makes it more challenging when we're doing surgery to get a nice cosmetic outcome. So we can weigh out, all the pluses and minuses once we have a diagnosis and take into account all of the factors to decide what treatment would be best for you.
Bottom line, Jean, that is a personal decision. It's really a personal decision.
Wonderful. And then, besides a lot of our listeners wondering where to find nicotinamide, Shirley was wondering, I use niacin. Is that the same thing?
Excellent question. So coming back to niacinamide, which is a great molecule, niacinamide, nicotinamide, the "ide" indicates it's got a special chemical arm to it. So it is similar to, but not the same as niacin. Niacin has never been shown to have that basal cell skin cancer protection DNA, issue. Maybe it does, but the studies have not been done yet. We do not recommend niacin to our patients because it can cause significant flushing. So our patients who take niacin can get red and then they hate taking it, so then they don't take their niacinamide. Niacinamide, though, is very hard to find at the store, guys. I've been to every store in Minnesota, and I go to GNC and I go to the vitamin store and I ask for niacinamide, and they always bring me to niacin. I don't think many stores in our area stock niacinamide, so my colleagues and I always recommend finding niacinamide at your online preferred place. So niacinamide, 500 milligrams twice a day is what has been studied, and you can look at your favorite drugstore.com or Amazon, whatever your online of choice is.
And then Debbie was wondering, any recommendations for sunless tanners without the orange effect that they often cause, and if they're toxic at all to you?
You want to take that?
Yeah, definitely. So I like using the wipes just because I think you can get better coverage. Sometimes the lotions, you miss spots and then you can look really spotty and not natural at all. So the one brand that I like to use is called L'Oreal. There's a L'Oreal wipe that goes on really nice, smooth coverage. Another brand that I like is called Saint Tropez, and that often comes with the exfoliator kit, so you can kind of exfoliate the outer layers of your skin, and that way it allows for smooth application. And they have different lotions and foam varieties that you can use.
Do you like Mindy and I sometimes recommend to our patients using a cream with lactic acid a few days before you do your self-tanner, because lactic acid helps break down dead skin cells. So you can do an over-the-counter cream that has lactic acid, and a great brand is Amlactin, CeraVe with lactic acid. You can use some of those creams for a few days, exfoliates, and then you do your wipe. So that's when we see the best results.
Definitely.
And then what is your best recommendation for mineral sunscreens?
You want to take it, Mindy?
Sure. Well, we've got a variety of options up here. My favorite is Elta MD. There's a spray that's great for the whole body. We have a specific lotion that goes on as kind of a moisturizer for the face. I like to use that one because I have acne-prone skin, so this one doesn't clog your pores and cause acne. And then I think we spoke about this one yesterday, but everybody loves the Silk Shade Tinted because it gives you a little bit of color as well. So these are really great. Some of the La Roche-Posay
We love those too.
are really
yeah.
great. Yep. My kids' favorite is this Blue Lizard. It's kind of fun for them because the bottle actually turns blue when there's any UV exposure. So they say, "Oh, Mom, got to get our sunscreen on.
That's
the bottle's
great.
blue."
And Vanacream also makes like if you're super sensitive skin, Vanacream, which is this wonderful brand, which was originally made in Rochester, makes a very hypoallergenic mineral-based sunscreen too. So, and a lot of good options. That's it. Awesome. Thank you, everyone.
Thank you.